from the Asian Community Development Council. This is Family in Focus, Mondays at 12 noon on PHLV Radio.
Good morning, everyone. Happy Monday. Welcome back to Family in Focus, brought to you by the Asian Community Development Council, or ACDC. Every week, we bring topics that will be meaningful, will be insightful, will help you in everyday lives, especially for you and your families. And today, we're talking about an issue that will affect a lot of people, if not already, when it comes to health insurance. And now, with the passage of the American Rescue Plan Act of 2021, we're going to talk about what that means for you, especially for a lot of people still dealing with maybe unemployment. They're still not working and not working fully, and they need that health insurance for every member of their family. So whether you're the Asian American community or not, I think this information will be really important and helpful for you. So let's get started. Let me introduce my guest for today. We have Rosa Alejandre. She is the Navigator Program Manager with Nevada Health Link. And we also have Joy Avendano, who is one of the health navigators at the Asian Community Development Council. So we'll bring in Joy in a little bit to talk about her experience so far with all the changes and how that's affecting all the clients that ACDC is helping right now. So we're going to get her perspective on that in just a little bit. But first, we're going to start with you, Rosa. I know you've been a guest on our show quite a few times, giving us just really good information from your perspective working with Nevada Health Link. So talk to us overall now with the American Rescue Plan Act that was that passed in March, when you said it was in April, right, when a lot of these changes started taking place.
And that's correct, Petrania. And thank you again for having me on your show. I really appreciate it, because this is a great way to get the community involved as well, and also so that they know what's going on. And as you mentioned, the American Rescue Plan Act, as you'll hear, we have the acronym of ARPA. I'll refer to it as ARPA. It might be a little bit easier going forward. ARPA was signed in March of 2021, although a lot of the changes that it actually implemented didn't start till April of this year. So, for example, COBRA. COBRA has right now, federal government will pay COBRA subsidies for between April of 2021 through September of 2021. It's only going to be for 6 months, but that will be a huge help for those that are on COBRA right now. So if you have a federal COBRA plan, you can definitely talk to your human resources and find out how they can assist you with paying that subsidy. So that's a big one. The other one is that the open enrollment period has been extended through the special enrollment period till August 15th. So we have aligned with the federal government with that as well here at Nevada Health Link. As you know, Nevada Health Link is a state-based exchange. What that means is that here in Nevada, our executive director and our board, they get to decide what we can implement and what we can't, and see what's best for Nevadans. Although the FFM, which is a federal facilitated marketplaces, that is all affected by what President Biden put into effect. And so thankfully, with our executive director's leadership, we've been able to implement a lot of good things, especially with this new administration, that they're very prone ACA as well. And the best thing is for unemployment, anybody that has received unemployment in 2021, if you have received unemployment at least 1 week in 2021, please come visit Nevada Health Link, because you may be able to receive even higher subsidies. And not only that, even $0 premium plans. Mm-hmm. So let's say, for example, you've already had a plan with Nevada Health Link, and you didn't know that, oh, I had unemployment. Come and check us out again, please, because you may be able to get a $0 premium plan and, like I said, larger amounts of subsidies. So those are the best things. Also, another thing that was affected was the federal poverty level. Before, tax credits used to go up to 400% and they would cap off. Now that no longer applies. It will go up to 8.5% of the income of the household. So before, it was based at, for example, a family of 4 can go up to $104,800. And that would cap right there for the tax credit. Now, a family of 4 making more than that, as long as it's not more than 8.5%, they may be able to get a subsidy. So we're asking all Nevadans, please make sure to come to Nevada Health Link, check out our plans. They're very affordable. They're all qualified and comprehensive, certified. They provide coverages, especially for pre-existing conditions and mental health. And you just don't want to be without health insurance right now and going forward. As you know, COVID, you never know who's sick and who's not. And you just don't want to get yourself in a situation like that. But again, come visit us at nevadahealthlink.com.
I know there's information we could put up on the screen as well, just about how this affects them, especially with Nevada Health Link. So can people get more information, going to your website, finding more information on what this means? I mean, there's so much information. I know we're giving us a lot right now, but if people want to can they call you all directly, or they can go to the website and get more information? What can they do?
They definitely can visit our website at nevadahealthlink.com. It's usually on our landing page, but if you're having trouble, we also have a search tool. Just type in ARPA or American Rescue Plan Act. It'll give you all the information. You can also give us a call at our call center, 1-800-547-2927. Our representatives are very knowledgeable, and they're able to give you that information as well.
Yeah, I know it's been tough for so many families out there. And talk to me about that. Just in the past year, I know we're kind of, with us, more people getting vaccinated now, kind of coming out of that tunnel. But I'm sure this is still affecting so many people because we can't, quickly turn around. The economy is the same. People's jobs are the same, right? So that's what you're seeing on your end as well.
Exactly. And as you know, Las Vegas got hit really hard. I'm sure Northern Nevada, the whole state of Nevada did. But as I'm here locally and I see all the casinos here in Southern Nevada, we saw quite a bit of a job loss. And so we know that there's quite a bit of consumers that may not have access to healthcare because they used to get it through their job. So we're asking them to please come visit Nevada Health Link. Again, all of your information is confidential. We're just here to see if we can assist you or at least be a resource to you so that you know where you can go if you need health insurance.
And talking about being a resource to the community, I think this is a good time to bring Joy into this conversation. And Joy Avendano is one of the health navigators at ACDC, and they do their work. They partner with people with Nevada Health Link and other, healthcare agencies. And Joy, talk to us a little bit. If people have never really come and worked with ACDC and reached out to health navigators, what do you do exactly at your office?
We have at ACDC, we have licensed health navigators, and they're bilingual. Most of them are bilingual, English, Spanish, English, Tagalog, English, Mandarin. So bilingual, because we have ACDC has the Asian American Pacific Islanders, right? So we try to be, the health navigators try to be bilingual to help them out. Okay, so with ARPA, we get a lot of updates for our enrollment. We're busy. It's keeping us busy, and people are happy. You can see the smiles in their voices. I have a client. What ARPA is with enrollment is you update the enrollment, and then they will get higher subsidies, so that a client with a $66 monthly payment goes down to $6. They're happy.
Yeah.
$17,000 deductible, it goes down to $0 deductible. An example of another client is she wants to keep her present plan, but she was given a subsidy, an increase in subsidy. All she wants was $0 copay for a specialist, was because she goes to her specialist every month based on their needs, right? And there's a family whose subsidies were higher, and I encouraged them to upgrade their plan to get more benefits. And they will end up having a family of 5 having $0 copay, $0 monthly payment, $0 deductible. Oh, that's heaven for them. Because with the savings in money, they can buy other things like food, pay for utilities, right? So yeah, we're very happy with ARPA. I hope it gets extended beyond August 15. Yeah, Rosa.
This sounds like a great benefit for so many people. And Joy, you speak Tagalog, right? But
I do.
And how much does that help in terms of just giving people all these information? Because these are the changes that they may not know about if English is not their first language, or they're not kind of having access to all this information.
Although most Filipinos are educated in English, textbooks in English, teachers in English, right, still some people have the barrier of the confidence of speaking in English, right? It's still a barrier. So when they find that we have Filipino speaking, they're more comfortable and we can speak in our language. But sometimes there are English words that you cannot really translate.
Right.
But luckily, Filipinos have Taglish. They understand. We speak in Taglish. So we can say enroll. How do you say that in Filipino? Say enroll. They will understand.
Yeah. Well, it's not just the language too. I understand that, but just that, meeting you, Joy, and maybe other people who are from the same culture. I mean, you understand kind of the family dynamics and maybe what they're going through, and just having people kind of from the same culture. I think that really helps, especially things like healthcare and health insurance. That can be very personal for a lot of families.
Mm-hmm. Mm-hmm. Yes, definitely.
Yeah, and you get to talk to them, and not just Tagalog. What other languages? I mean, Vietnamese, Chinese. We offer help in many languages, right?
Yeah. Some would directly ask, "Do you have a Vietnamese-speaking health navigator?" Of course, we do. You have Spanish-speaking? Yes, we do. You got it.
No, that's great. And Rosa, bringing you back, Joy, she was bringing up these specific examples of people who, can save lots of money. I mean, is that what you're seeing out there, that this can really affect families in big ways when it comes to subsidies or just kind of lower insurance rates?
And that is correct, Petrania. We have actually seen that. I want to say a little over 7,000 consumers have seen already savings that have came back to their application and just updated their information, and they have seen savings already in addition beginning in April. We are going to be running what's called a batch job in the first week of June. So what we want to do is for all those consumers that are on Nevada Health Link already that did not get an opportunity or just simply haven't heard about coming back to update their information, we want to go into their accounts and see if there's something else that we can do, perhaps with their information that they already have, and give them a higher subsidy. So we're encouraging anyone that is on Nevada Health Link or that is not on Nevada Health Link, come and visit us, because there is much more subsidies due to ARPA right now.
So clarify, if they already have a plan in place, can they still change because it's open enrollment is still August 15th till August 15th? Is that still not just for new people, right? But if they already have a health plan, they can still make changes?
And they will be able to make changes, although the new plan will not start until June due to the technicalities of what we have going on with our platform as well. So we just want to make sure no one will be without health insurance, but if they do want to change a plan, they can get that changed over as well. It will be effective June 1st. Those are for our current existing customers. Anyone that is just shopping and perhaps didn't come in and finalize the plan, they are able to change it right now, and they'll start off with their new plan as well.
Awesome. Okay. And then for now, this is just kind of ongoing. So there's no deadline that this is going to end, or what do people need to know? Is this kind of an urgent thing where they need to go out and do it as soon as possible? If they want to, get health insurance, obviously, but if they want to make changes?
Well, for Nevada Health Link, for us, it's always urgent that they enroll as soon as possible. And the one main reason for this is because insurance coverage works this way. You need to have the coverage prior to you being sick or submitting that bill, right? So if you want to get covered for an illness or covered for a visit, you need to have the coverage prior to. So that's why for us, it's always urgent. But yes, the open enrollment, special enrollment period will be till August 15th of this year. So for now, that's what the federal government has stated, and Nevada Health Link has said we will align with that. So that's what we know for sure, August 15th. But we're asking anybody, please don't wait till the last minute. You could be saving money right now and come and visit us, because there are so many affordable plans. We have 50 plans, 5 carriers on our exchange, 6 carriers for dental. So there's plenty to choose from.
Yeah, no, and that's, I think it's a resource that maybe if people had just moved here, and I've known plenty of people personally who just moved to Nevada, so they're not familiar with the system here. So I think having the information that we're putting out here is just really important too. And having options, I think that's important, right? To see what options people need out there.
Most definitely. And all of our navigators, we have 7 grantee organizations here in the state of Nevada. A few are in the north, and the majority is here in southern Nevada. We also have brokers that we work with throughout the state, and they all provide free assistance. So just give us a call, or you can even go on the website, put in your zip code, and it'll tell you who's the closest one to you. Again, ACDC is one of our great partners. They're one of our grantees, and they've been with us for several years, very knowledgeable, and we appreciate that they understand having bilingual people there. It really helps the community. It breaks that ice, and it allows the trust for the community to understand they know their language, they know where they're coming from, and they can assist them in their own language.
Yeah, and I've seen that in person. And Joy, I wanted you to bring you back here because we've been talking about this, how not just health navigators working directly with clients, but we've had the COVID-19 vaccination clinics that have been going on that the health navigators have been helping out with too. And Joy, talk to me about the people coming in right now. I know we're talking about people coming out of the pandemic. A lot of people have been coming through ACDC to get their COVID-19 vaccines. What are they telling you? I mean, obviously, are there still people out there without health insurance and still needing this because of all the different things that have happened to them just in the past year?
You mean the COVID vaccine clinic that we conduct?
That, and just in general with their healthcare, I'm sure, they are coming to you just with all sorts of stories, right? And in terms of things affecting their health, not just COVID-19, but everything else as well.
Yeah. COVID-19 vaccine is free for all, right? Everyone knows that. Right. But we conducted, in coordination with Immunize Nevada, a clinic for COVID-19 vaccination, which is now being held every Sunday starting June 6th. And then in the beginning, we've got lots of dose 1 people. I heard it's a challenge because some people are scared, skeptical, blah, blah, blah. But as soon as they learn that Pfizer is good, we're giving out Pfizer vaccines. Yeah. Then there's an uptick in enrollment registration for COVID-1 first dose. Yeah. And then after 3 weeks, we conduct the second dose. And there's a lot of people too coming in because those are the first doses people, right? They come back after 3 weeks. And then we promote it for walk-ins. We go downstairs and then we distribute flyers. We do get people for walk-ins.
Yeah.
For the COVID vaccine, yeah.
That's great. And to remind people, you don't need health insurance to get this. Anyone can get this, right?
Because it's free. Yeah. And when someone will ask, do you do the vaccination? Not us. People from Immunize Nevada, they want to make sure we are, the ones who will do the vaccine are medical people, right? So we have pharmacists, we have nurses, we have one doctor, Dr. Alex Wong from Immunize Nevada.
No, it's been great, and I've been there myself, and talking to people who are coming in and getting vaccinations. And I know one Vietnamese woman I talked to, Vietnamese American, and she said, at first she was scared, like you said, and then she started hearing from her friends in the Vietnamese community, and they said, okay, this is good, it's efficient, I'm fine, So getting that assurance from their own community, Joy, I think we've seen that really helped people too.
Oh yeah, and within the vaccine clinic days, there are those who will ask about health insurance. What else do you do for the community? This and that, and we give them out flyers. So it's a good venue for promoting what we do for the community.
Yeah. So what can you say? I know you have, ACDC has 2 offices, right? The main one, the headquarters at Flamingo, but the Shanghai Plaza, that's the one that we conduct the COVID-19 vaccination. But people can choose which ones to go to if they need help with, especially signing up for health insurance.
Oh yeah, we in Flamingo, which is the corporate offices, we have a health navigator room, and there's always 2 people at a time every day. And in Shanghai Plaza, there could be 1, there could be 2 sometimes. It depends on the schedule and availability of the staff. But mostly, people who don't have means of transportation, it's easier for them to go to Shanghai Plaza because of the accessibility of transportation within the Chinatown area.
Right.
Yeah. But most of them have means of transportation, so it doesn't really matter. Like most of the time, our Vietnamese and Spanish health navigators stay here in Flamingo, so they would invite their clients over here. And I stay in Shanghai most of the time. I get most of the Filipino ones. Yeah.
No, that's great. And we'll put some information up on the screen here for you as well for our viewers who are, looking to go. But obviously, Shanghai Plaza is where the COVID-19 vaccination clinic is still going on, but always contact ACDC if you have any questions. And, there's so many services aside from healthcare, health navigators. So check into that as well. So thank you so much, Joy, for coming in and talking to us today. And Rosa, any last word for people? It seems like, with everything that's happening, especially with this American Rescue Plan Act, we're looking at, this optimism that help is out there and people will get the help they need.
One main thing that I want to let people know is that Nevada HealthLink is the state-based exchange for the state of Nevada. So we are the official agency that provides assistance, and only with us can you get the subsidies. One. Second, all our information is on our website. Very easy to go and see NevadaHealthLink.com or give us a call, 1-800-547-2927, and they will be able to assist you as well in any language that you need to make sure that you get your assistance, whether it's just a question or a help finishing your application.
Yeah, this must be a good feeling for you, though, that this kind of help is available and out there for people that you're trying to assist.
Most definitely. The best thing is that Nevada HealthLink their mission is to simply cover as many Nevadans as we possibly can. And we just want to make sure that consumers know we're here all year long. We're not only here during open enrollment, but we're here all year long with navigators and brokers to assist them throughout their process. Any questions you have, give us a call and we'll see what we can do for you.
That's great. All right. Well, thank you, Rosa Alejandre, for being on the show today from Nevada HealthLink, and also to Joy Avendano, working hard there at ACDC and getting all the help, especially for the people who speak Tagalog. Joy is there to help you. So thank you to you both, ladies, for being with us today, giving us some great information to the community. And thank you for watching here on Family in Focus. And we'll be back next week. Have a great day.